I'm Bill Osmunson, a dentist, master's in public health, and I want to welcome you to about an hour here on fluoride, excess fluoride. Many of us are ingesting too much fluoride, and it does not have the benefit that some would suggest, and it does have harm. A little bit about myself. I am a dentist of 40 years, graduated from Loma Linda University in 1977 with a master's in public health in 1974. I worked in private practice, owned my own businesses, dental practices for most of the time. I did spend a couple years in Las Vegas at the Las Vegas Institute for Advanced Dental Studies. I also spent a year working in a very rural Indian health clinic for the Indian Health Service. And so I've worked with high-end here in Bellevue, very wealthy. I've also worked as cosmetic dentist, working with other dentists, and I do enjoy education. I'm going to be dealing with a subject that may rub some people wrong. I know it would have for me for about the first 25 years of practice. And I know that a paradigm shift for me took about 2 years. So I don't expect you to, in 1 hour, change your view on fluoride, but I want to challenge perhaps some of your current thinking and stimulate more thought and research. We need much more. My mentor when I started out in healthcare was a thoracic cardiovascular surgeon who had been a missionary for many years, and he reminded me repeatedly that 50% of what we know is wrong. We just don't know which 50%. And so that has stimulated me to reconsider things such as mercury fillings, which, are not safe for the trash, illegal to put me in the trash and illegal for me to put in the sewer. And I can't send them in the mail because it's too toxic for the postal workers, et cetera, et cetera. So what makes it safe in the mouth? Well, I knew that was a problem. I knew temporomandibular disorders were controversial, and I won't get into that, but that's a problem. And root canals are discouragingly. I used to say the most successful thing we did in dentistry until I got an ICAP machine, started realizing that the infections were still there. So that's a discouraging area. And as I was walking down the hall of my office, I looked down and saw some Crest toothpaste, and I thought, oh no, I don't want to look at that also. Not another item that I should look at, but I did. And I'll go into explaining that a little bit more. So this is just a little scratch on the surface. You'll need to consider, think about it. I'll give some ideas at the end of what you might consider for your practice. The intent of fluoride, as we all know, is a theoretical mitigation of dental caries. It doesn't prevent caries. It may mitigate the disease to some extent, and we need to learn more about does it and how much if it does. There's systemic use and there's topical use. In very simple terms, the topical use is FDA approved in toothpaste. It is not approved systemically. We'll get into more of that. Most of the time we'll be talking about systemic here. Outline. There are reasons to reduce fluoride exposure, and there are several streams of evidence we need to look at in detail, but we'll just touch on them briefly today. Fluoridation lacks individual consent. Swallowing fluoride is not FDA approved, nor does any government agency regulate the addition of fluoride in water or swallowing water. Now, I want to preface that a little bit here with they don't regulate it as far as looking at all aspects of the fluoride. In other words, the safety of it, the dosage of it, and the effectiveness of it. That's all three areas need to be combined together. CDC, of course, does say it's effective. They don't have that much science on it, but they say it's effective. The EPA does not look at effectiveness because they're not allowed to. And the FDA says it's not effective. And so nobody really regulates it, especially in the water that is added to the water. Many are ingesting too much fluoride. That is probably the biggest key for me that is of concern as a dentist. Swallowing fluoride lacks significant benefit. I mean, if it doesn't work, why are we doing it? Swallowing fluoride is not safe for all. So let's look at these 5 different issues here briefly. Fluoride lacks individual consent. I remember years ago a patient came to me and said, Bill, but you say fluoride is very good, swallowing is good, fluoridation is good, topical is good. What about freedom of consent? I mean, water fluoridation removes that freedom for me as a patient to choose fluoride or not choose fluoride. What do you think about that? And my mouth flopped open and I had nothing to say. Nothing came out of it because, of course, I believe in freedom and consent. This is why we give PARQ, SOAP. I mean, this is why we get individual consent from patients before we do a treatment. We get their signed consent. And if it's something that they don't have consent on, we should be very cautious. Now, in public health, the ethical use of public health does permit police powers, treatment without consent. And it's to protect the public from the spread of highly contagious diseases, to protect our neighbors, and from highly lethal diseases. Although dental caries can lead to pain and infection, caries are not considered highly contagious or highly lethal, and fluoride ingestion is not approved. Any one of those should stop mass medication of any disease. The courts have been very clear with anthrax. You can't give a medication even to soldiers in time of war without FDA approval. It has to be FDA approved. Not only the substance, but for the disease that it's being treated. Now, dental caries, it can lead to an infection and it can lead to death, but it's not highly lethal. I mean, the flu and colds are much more lethal. We need to focus on a healthy diet, accurate hygiene, early diagnosis. Those are all very important aspects rather than chemotherapy. Number 2, swallowing fluoride is not FDA approved. As a person who went through the FDA process to get approval for a dental device, my background with the FDA has been one of reasonable. I approve of what they're doing. I think they're good at what they do, reasonably. So if it's not approved, then I want to know why it's not approved. Why did the FDA say no? These are the scientists, the pharmacists, the toxicologists that approve drugs. Why did they not approve it? The Food and Drug Administration says on the toothpaste label, do not swallow. That's their bottom line, do not swallow. For efficacy, for fluoride pills, they say the evidence is incomplete. There's no substantial evidence of drug effectiveness as prescribed, recommended, or suggested in its labeling. Marketing is in violation of the new drug provisions of the FDA Act. So they say that it's not effective because the evidence is not adequate. Well, maybe they're right, maybe they're wrong, but in this case, I feel they're right, and I respect their view. Anytime we give medication to someone that's not FDA approved, we need to be cautious, especially when it comes to something like fluoride, which is highly toxic. If it's not FDA approved, then every law that I've seen, every state that I've seen, fluoride is a poison. And it is exempt from poison laws when it is regulated under drug laws or pesticide laws. So if it's not a drug, then it is a pesticide. No, it's not. Then it is a poison, and it's regulated under poison laws. Congress defined drugs in law as articles intended for use, or if they're listed in the pharmacopoeia, it is intent of use that makes fluoride a drug. Fluoride is a drug according to the boards of pharmacies. When I've asked them for determination of whether it's a drug or a poison, they say it's a drug, not a poison. The FDA testified to Congress that fluoride is a drug. The FDA remains responsible for regulating the addition of drugs to the water supply for healthcare purposes, according to the legal counsel of the EPA. Okay, so it's pretty clear that fluoride is a drug. and it's supposed to be regulated by the FDA. And the FDA says the evidence for efficacy is incomplete. I picked up my toothpaste tube as I was walking down the hall, and I said, okay, let me look at it. Let's at least read the label. And I looked there, and it says drug facts. Okay, we know fluoride is a drug. So what else do they say? Do not swallow. Well, what's their concern? Well, at least for kids, their concern is use a pea-size amount. Now, on the toothbrush that I have there, that's twice the size of what a pea-size of fluoride toothpaste has fluoride, because the EPA is looking, the FDA is looking at 1/4 milligrams of fluoride as their concern. And my toothpaste pea size is a big pea size. They're now talking more about a smear, like on the top right picture, you'll see a tiny, tiny little bit of toothpaste that's on there of a grain of rice size or a smear size. Now here's the problem for me as a simple dentist. If the FDA, who's in charge of this thing, says don't swallow 1/4 milligram, and my city and water district are forcing me to swallow the same amount in each glass of water, we have a conflict. Who am I to believe? The backhoe operators and the school teachers and the business people who are running the water district and the city elected officials? Or do I believe the FDA? Who has more scientific credibility on this thing? For me, I'll take the FDA. The EPA says, is instructed by the Safe Drinking Water Act, no national primary drinking water regulation may require the addition of any substance for prevention of healthcare purposes unrelated to the contamination of drinking water. Seems pretty straightforward, but I contacted the EPA and I said, can you explain that a little bit to me and elaborate? And they wrote back in a response to a Freedom of Information request. The Safe Drinking Water Act prohibits the deliberate addition of any substance to drinking water for health-related purposes other than disinfection of the water. Well, fluoride doesn't disinfect the water. That's not the purpose of it. That's not the intent of it. It's there for the health-related purpose. And the EPA therefore kind of washes its hands, and that's why their legal counsel said, no, it's the FDA that's responsible. And the FDA says it doesn't work, and the EPA regulates the water. Well, now let's think about that a little bit. Suppose we wanted to add Viagra to the water, or penicillin to the water, or something else. Who would regulate that? I mean, all we have to do is take a little bottle, put some Viagra in it, and take a few drops of water, and then we have Viagrated water, and we could sell that without a prescription, without FDA regulation, right? No. That they wouldn't allow us to do that. But when it comes to fluoride, they seem to do that. Okay, number 3. Many are ingesting too much fluoride. Well, we know that the EPA, not the EPA, but the Health and Human Services, along with representatives from the EPA, FDA, and other organizations, recently reduced the concentration of fluoride in water to 0.7 parts per million, from about a range of 0.7 to 1.2, down to the bottom or below. But they gave it 0.7 part per million. Why? Because many people are getting too much fluoride. We're ingesting more and more from many different sources, so they recommended that it be down lower. Now, do they regulate fluoridation? No, but they do recommend that it be reduced. And have all water districts done that? No, to my knowledge, there's a couple that still are persisting to go above 0.7, or maybe more than that, but I haven't checked all of them. So we're getting too much fluoride. How do we know that? Well, there's huge increases in dental fluorosis. Dental fluorosis, as most of you know, because I think most of you are dentists who are listening to this, is marks on the teeth, a biomarker of too much fluoride during the first 6 years of life, or 8 years. What we have when fluoridation started is a assurance by the experts that dental fluorosis would not increase, or well, maybe not more than 10 to 15%. But in 2000, well, before that, 1986, they redefined dental fluorosis to require 2 teeth, because it was about 80% of the public children were getting dental fluorosis. So they redefined it, and that dropped it on down into the 30s. And in 2000, National Health Assessment and Nutrition Evaluation Survey reported about 40% of children had dental fluorosis. And in 2012, about 60% had dental fluorosis. So we know that dental fluorosis is increasing. At what point do we say, hey, it's still increasing too much and we've got to reduce it even more? We see that 60% were unaffected in 2000 and about 30% unaffected in 2012. Of course, we have more current data than 2012. The problem is that although all the data has been released, dental fluorosis rates have not been released. So did they go up? Did they go down? What's the story on the most recent surveys? And they have not released that. So we'll go with the 60% have dental fluorosis at this point or more. World Health Organization, they're correct in their statement that dental and public health administrators should be aware of the total fluoride exposure in the population before introducing any additional fluoride program for caries prevention. How much are we getting? It comes from more than just water. It comes from medications. It comes from dental products. It comes from foods. And when we use fluoride pesticides, why that increases, and fluoride post-harvest fumigants. So how much are we getting from all sources? The World Health Organization continues estimation of the amount of fluoride ingested from all environmental and dietary sources is important so that rational and scientifically sound decision can be made when guidelines for the use of fluorides are reviewed periodically and modified. When we don't have anybody who is in the United States legally responsible for reviewing all aspects of fluoride, then the whole concept of fluoride is not reasonably reviewed periodically or modified. Dental fluorosis is a biomarker of excess fluoride exposure while the teeth are developing under the skin. On the left, we can see dental fluorosis, white striated lines. Not all white spots, not all brown spots are dental fluorosis. Dental fluorosis has more of a streaky look to it than a well-defined border. Treatment on it can be very expensive. I know I was charging $1,500 per tooth for a while. Dropped that down to $1,000 per tooth. We're getting lower costs on our laboratories, and we have reduced some of the costs for some of us. Some are still at $2,000 a tooth, but it's easy to do 12, 14 teeth to make them look cosmetically nice and cover up the dental fluorosis on the top teeth, and then of course the bottom teeth. One of the biggest problems that I find for people who are pushing fluoride is they fail to, and I failed to, really consider that when we add a very controlled amount of fluoride to water, we are talking about a concentration of fluoride in water. But not everybody drinks the same amount of water. So therefore, the dosage per person, milligrams per kilogram per day, is not controlled. Some average people drink about 1 liter per day, slightly less than a liter, but just about a liter per day is what it's estimated that most people drink. But the 90th percentile drinks about 2.3 liters per day. The 99th percent drinks about 4.8 liters a day. The 100%, well, they drink over 10 liters per day. So the dosage of fluoride for individuals increases and increases and increases. And of course, that doesn't even include foods, medicines, dental products, toothpaste, etc. Now, several human studies show that there's an IQ loss at 3.4 milligrams per day or less. And this is actually high. It's showing even less than that now. Down to 2 milligrams of the latest study showing that there's some IQ loss. So we're finding that there's more and more problems at lower levels, and we'll get into that just briefly. Dental fluorosis in the electron microscope. We can see the little holes, pits, and all the rest of it. That's one of the reasons that dental caries goes up when we get too much fluoride. We'll look at that a little bit more in just a bit. American Dental Association, after 60 years of community water fluoridation, we still do not know how much fluoride is required to prevent caries. The World Health Organization says we need to know how much we're getting. And then what is it required to prevent caries? We don't know. So we don't know how much we're getting. We don't know how much is the optimal for the blood concentration. What's the optimal fluoride concentration for urine? What's the optimal fluoride concentration for dentin? What's the optimal fluoride concentration for enamel? We don't know. And what is safety for each of the different tissues? We don't know that. It takes 20 years is the half-life of fluoride in the body. So it takes 20 years to get half the fluoride out. You see someone with dental fluorosis, you know their bones have been hit hard with with excess fluoride while it was developing. That's going to take about 20 years to get that excess out of there if we don't ingest any more fluoride. It makes no sense to treat patients with fluoride varnish or fluoride supplements or an additional fluoride when we can see on their teeth that they have dental fluorosis, a toxic overdose of fluoride. We know their bones have had too much, their brains have had too much, their soft tissues, their mitochondria, on and on and on, has had too much fluoride while they're developing. Why do we give them more fluoride when they've had a toxic exposure? 60% of children now have dental fluorosis. At least 60% of the children should not be getting dental fluoride varnish treatments. Outline. Swallowing fluoride lacks significant benefit. That's the next stream of evidence we need to consider. CDC, ingestion of fluoride is not likely to reduce tooth decay. Well, obviously the CDC has other statements where they say it's one of the top 10 public health achievements of the 20th century. Now, not all of the CDC scientists agree. And systemic reviews of fluoride results show that the reviewed original studies on economic evaluation of caries prevention do not provide support for the economic value of fluoridation. After 70 years of fluoridation, there's still no gold standard prospective randomized controlled trials on effectiveness. Probably one of the main reasons the FDA says the evidence is incomplete. We can do prospective randomized controlled trials on fluoridation. We can do it with fluoride supplements. We can use remote villages and haul in their water randomly controlled. We can do this in our communities, in remote areas. It can be done. It probably has been done, but not published. The FDA says the final manufacturer is the responsible entity for getting FDA approval. So it's not the EP that's supposed to get approval. It's not the CDC that's supposed to get approval. It's not you and me that's supposed to get approval. It's the manufacturer. And who's the final manufacturer? The city, the water district, who is formulating, putting the substances together and shipping it out and selling it. The water districts are supposed to get FDA approval. Well, instead of getting FDA approval, they go to the voters. And so we get into that whole political problem. One of the things on fluoride research is that the studies have serious limitations. Many of the studies have one or more of these limitations, or more than one of these limitations. I don't know of any of them that just has one. There's not one study that corrects for unknown confounding factors, and we'll get into that in just a little bit. Not one prospective randomized controlled trial. Socioeconomic status, and we'll get into that, is not controlled on many studies. Inadequate size, difficulty in diagnosing decay. That is huge. Now, it wasn't until recently that Dr. Lineback talked to me about the fluoride bomb. I'd never heard the term before, and I don't go over it in this presentation here, but what happens is when you have a tooth that is very hard on the surface, in the grooves, the decay can get on in there and grow. Now, if you have a softer tooth that has not had the fluoride on the surface, that crumbles away at the groove and we go, oh, there's some decay, I can see it. We clean it on out and we say, okay, you had a filling there. But when it's hard on the surface, the fluoride, the decay gets really deep inside the tooth and it becomes a huge hole. Now that I know it, I see it frequently where we have a fluoride bomb. Didn't catch the decay until it got really big because fluoride makes the diagnosis more difficult. It delays the diagnosis. And that may be one of the reasons we think that it's effective, because it delays diagnosis. It also makes the tooth harder so that we have more complete cusp fractures, more crowns in the fluoridated communities. Delay in the tooth eruption is not controlled. So there's about 6 months roughly of a delay in the eruption of the tooth in fluoridated communities. And so therefore, if you're looking at an 8-year-old, you're not looking at the tooth having been in the mouth for the same amount of time. Diet's not controlled. Total exposure of fluoride is not determined. Oral hygiene not determined. Not evaluating lifetime benefit. Estimating or assuming subject actually drinks the water. Dental treatment expenses not considered. Mother's fluoride exposure, breastfeeding, infant formula is not evaluated. The NTP, and they're looking at this neurotoxicity problem, and they didn't start the evaluation until after the pups had been weaned on their animal study. Well, we know that the fluoride causes problems in utero and during the development of the tooth. So we don't have a good comparisons here in many of these things. Fraud, gross errors, and bias are not corrected. I mean, when a study is done and it's not published because it doesn't come out with the results that you want, is that bias or is that fraud or is that gross error? But we need to be publishing whether it's beneficial or not. Good researchers have told me that repeatedly. Genetics not considered. Caries have decreased to low levels regardless of fluoridation of water or salt. It doesn't make any difference if you fluoridated or if you got salt, fluoride in the salt. If you compare the developed countries of the world, they've all decreased dental caries to similar low levels. In fact, they have decreased it faster than we have for whatever reason. What caused the decline? It wasn't fluoride because they don't use fluoride. So what caused the decline? Let's look over a history in the United States. Dental caries in 1930, when my mom was preteen, was about 11 cavities per person. That decay teeth declined until fluoridation started when there was about 5 for the same age child. And that declined to, in 2000, to about 1.5. But what caused the decay to decline, the crushing reduction of decay prior to water fluoridation and fluoride toothpaste? We don't know. So any study after on fluoridation doesn't include those items that are much more powerful than fluoridation. And so when we aren't controlling for them, how do we know that this family, this person, this community, this state didn't all of a sudden start getting these other factors that affect fluoride, affect dental caries? So the trend is similar regardless of fluoridation. And let's look at 2009 Journal American Dental Association, the association between enamel fluorosis and dental caries in U.S. school children. At the bottom of the graph, we have the concentration of fluoride in the water. And when we increase the concentration of fluoride in the water, we see on the blue lines that, yes, indeed, dental fluorosis increases. That's well known, documented. The toxic dose of fluoride increases. And when we look at the red lines, we can see that at less than 0.3 parts per million, we have caries experience. And as we go to the next two lines, we can see there's a tiny slight decrease there. And then it goes back on up. Well, we know that there is supposedly this sweet spot. If we get a little too much fluoride, then we get more decay. If we get a little less fluoride, then there's a little more decay. But the amount of change is very, very slight. And there's a lot, and the research has many confounding factors that are not included. So we're mass medicating everybody for that slight possible benefit, assuming they're drinking the same amount of water, assuming they're eating the same amount of fluoride from foods and medications, etc. But the decrease is almost non-measurable. In fact, several studies showing that it's really about 0.3 parts per million where we get our benefit, and then we don't get much different after that. So when I put ranked the states, 50 states, based on the percentage of the whole population fluoridated, and then I plotted the very good to excellent teeth of the poor and very good excellent teeth of the rich, we see that the poor have about 55 or so, 50% a little over 50% on average very good to excellent teeth. And we see about 80% of the children of the wealthy have very good to excellent teeth. And then all of a sudden the light bulb went on my head. Aha, socioeconomics is very powerful. When I was playing this game with my assistant, saying I could tell her whether they were getting fluoridated water or not by looking at the teeth, I was looking at socioeconomics. I know that. The wealthier people have better health. If you really want to do a lot of dentistry, go to the poor communities. Of course, they don't have money to pay you, but go to the poor communities. If you want to see people with good health, come to Bellevue here. A lot of dentists, and so we do a lot more cosmetic dentistry, a lot of other things that don't involve dental caries, orthodontics, and it just goes on. And we retreat the treatment that we've done in the past. Unfortunately, it doesn't last forever. Higher income, better teeth. This next picture is really telling. We do not know the optimal fluoride concentration for the tooth. We talk about optimal for water, but we're not treating water. We're treating tooth. So what's the optimal fluoride concentration of the tooth? Well, as it so happens, we don't know because teeth with caries and without caries have the similar fluoride concentrations in the tooth. The outer layer, like from toothpaste, does show an increase of fluoride, but throughout the body and the dentin of the tooth, it's pretty much consistent at a lower concentration, and that stays the same, and we don't see much difference. So we don't know an optimal fluoride concentration for the tooth. Still unknown. Teeth with caries and without caries have the same concentrations. Early childhood caries. You know, you'll often see a picture like this of, oh, we got to help the poor. And yes, we do. I've worked in an Indian reservation. I've worked in poor communities, and I've seen this kind of stuff. If you haven't, well, you haven't been a dentist very long. It's really, really gut-wrenching to have to work with children like this because they don't understand. You need to take them to the hospital. I almost lost a kid in the hospital once because of working on their teeth. Fortunately, I was in the hospital when it happened. It's something that this can be hazardous to take care of. It is gut-wrenching to see. The kids suffer and they hurt. We don't want it. But it's not because of a fluoride deficiency. These kids probably had fluoride. Well, their bottom teeth don't show much of a problem. So did the fluoride just go to the bottom teeth, not the top teeth? No, this was because of a bottle. It's a diet problem. Bad juice, not bad juice, but bad diet. Milk juice, soda pop, those kinds of things at night when the baby goes to bed. We need to get them off of that as soon as we can. Well, most samples of mother's milk don't have any detectable fluoride in it. That's right, don't have detectable fluoride, most of it. When they get a sample and they can detect it, the detection is averaging a mean of about 0.004 parts per million. So a child who gets formula made with fluoridated water, which the poor usually use because they can't afford to haul that water on the bus and everything, the poor usually fluoridated water, that means that they end up with about 175 to 200 times more fluoride than mother's milk for the baby. And that's when their brain is developing of most concern. And it's the poor, those with low IQ, that we must protect their brains the most. Let's get into that a little bit here. Measured evidence from the population at large has not reported cost benefit from fluoride ingestion. You know, they keep on talking about for every dollar spent on fluoridation, you're going to save $38 of treatment. Read the research for yourself. It's based on estimates of assumptions. Do you balance your checkbook on estimates of assumptions? No, we need to have measured evidence. If there's one thing that we measure in the United States, that's money. We're focused on money. Insurance companies know exactly how much money is being spent on dental caries. So why don't the insurance companies publish that data? Oh, they've assured me they will, but that's been years ago that they assured me. And they keep assuring me, oh, they will. I think they just haven't found that fluoridation communities, there's less of a cost there. That's what the measured evidence of research shows, Malpalm and others, that there's really no benefit from it. Current research by Coe, $3 per person per year for best case scenario savings. But this savings is eliminated by the estimated cost of treating dental fluorosis. So at the best estimates is $3, not the $38. That's just marketing. What about other countries in the world who've reduced their dental caries as similar to the United States? Well, they've rejected it and stopped it and rejected it and stopped it. In fact, the International Academy of Biological Dentistry and Medicine, the International Academy of Oral Medicine and Toxicology, American Academy of Environmental Medicine, the American Academy in Integrative Medicine, and others are now taking the position of no fluoridation, do not swallow fluoride. American Dental Association is still saying mercury, fluoride, all these things are safe, safe, safe. But they're protecting dentists, not patients. Our final item here I'd like to cover, swallowing fluoride is not safe for all. This needs to take years of evaluation to really look at this evidence. And I know I'm just scratching the surface in other areas, but most presentations, a person picks up one or two items and gems that they hang on to and go with. And I'm trying to change a whole paradigm shift in your understanding of fluoride and your belief in fluoride and what you were taught in dental school. I mean, this is impossible to do this in 1 hour. So we're just scratching the surface so that it opens your eyes a little bit to let's look further in the future. Swallowing fluoride is not safe for all. Or is it safe for anyone? Let's look at some of the evidence. The National Research Council, this is the highest scientific body in the United States. They give advice to governments. The EPA requested the National Research Council to evaluate fluoride and their maximum contaminant level goal. And they did. And the National Research Council told the EPA that their MCLG was not protective. Why? Well, there's a whole bunch of reasons that they looked at it here. Tooth damage was one, but they also looked at rheumatoid and osteoarthritic like pain, bone cancer, bone fractures, thyroid reduction, diabetes, obesity, kidney damage, reproductive problems, lower IQ and increased mental retardation, allergies, gastrointestinal diseases, and they didn't cover some areas that they should have covered that we're finding out now are causing problems. So these are the areas of concern. These are the areas that we need to look at with fluoride and what the research shows. EPA scientists, through their union, say no to fluoridation. The union voted. Now, this was not a political statement. This is their scientists who were, one of them was fired because they spoke up against fluoride, fluoridated water. And so they went quiet and spoke out through their union so that they wouldn't lose their jobs. Quote, in summary, we hold that fluoridation is an unreasonable risk. That is, the toxicity of fluoride is so great and the reported benefits associated with it are so small, if there are any at all. Wow. I remember first reading that, and I would, okay, maybe there's risk. Maybe we're getting too much, but it certainly is beneficial because I can see it in people's mouths. I know it's beneficial. And the EPA scientists are saying that it's not or no longer beneficial. What are they talking about? They're requiring every man, woman, and child in America to ingest it. Borders on criminal behavior on the part of governments. Well, after looking at this stuff for years, and I do feel like the EPA union is correct in what they're saying, that it is no longer effective if it ever was, that the risks are serious, and that governments should stop adding fluoride to public water. If you really wanted to swallow fluoride, just swallow a bit of toothpaste. Now, I know the FDA says do not swallow, but it's not like people don't have fluoride toothpaste, or they can get some free from the dental office. I give it free if they want it. There are pharmacies who will give fluoride products out free if a patient wants it. I mean, you can get this stuff free. Just don't eat organic foods and drink more tea and drink some wine, and you'll get more fluoride than what you should have. So we don't need to add more to the public water. Now, the EPA approved post-harvest fumigation with sulfurofluoride. Okay, let's back up just a little bit. There's many different products that have fluoride in it because fluoride is a marvelous, wonderful, powerful element. And so we use it in pesticides, we use it in rat poison, of course, and we use it in many different things at higher dosages. When we harvest our foods, we put it in a silo, we put it in storage, and if we don't cut down on the mold and the bugs and everything, why then it is ruined and we can't sell it and the poor farmer loses out on it. So we need to use some sort of a post-harvest fumigation system or a post-harvest protection system, refrigeration or something. And so bromine was used, and bromine increases greenhouse gases. And so global warming is a problem. So the US said, okay, we won't use bromine anymore in a treaty with other countries, and we'll go and use sulfurofluoride. So the EPA proposed to permit sulfurofluoride with residues on products, on most all foods, with, say, dried egg up to 900 parts per million. That's almost the same as toothpaste. Very high concentrations, which is, of course, given to children in schools, food lunch programs, and seniors' rest homes, those kinds of things. Getting high doses of fluoride, not in all dried egg, but in some, which they don't label it. So the Fluoride Action Network petitioned the EPA saying, no, this is not correct. And the EPA judge responded saying, quote, EPA agrees that the aggregate exposure to fluoride does not meet the safety standard of the Federal Food, Drug, and Cosmetic Act. Okay? The judge continued, for these reasons, the fluoride MCLG is not protective of the effects of fluoride on teeth and bones. 2, the fluoride MCLG is not protective of other neurotoxic, endocrine, and renal effects of fluoride. 3, the EPA has not adequately protected children. 4, the EPA cannot determine the safety of sulfurofluoride in the absence of a developmental neurotoxicity study. They haven't even looked. They didn't even do the study. They don't have studies to determine whether there is neurotoxicity. The EPA has underestimated exposure to fluoride. The EPA has committed procedural errors in violation of the Administrative Procedures Act. So this is, according to what I hear, the only time when there's been an appeal to the EPA where the EPA has granted every single objection that has been given to the EPA. But then, of course, Congress, Dow Agrochemical went to the legislators, and Congress passed a bill permitting sulfurofluoride post-harvest fumigants and overrode the EPA. Now, one of the concerns that the judge had and that the National Research Council in 2006 had was the fluoride being neurotoxic. There were some studies at the time, but quite a few studies have been translated from different languages now, and we have quite a few more studies. We can see on the graph on the left that most studies are clearly showing signs of neurotoxicity. On the right, we show what happens when there's a lower IQ in one of these studies. The difference between 0.04 parts per million and 0.08 parts per million serum fluoride concentration. There's an 8 IQ point drop, and that shows 8 IQ points for all people in all IQ brackets. Here are some of the studies, many of them below the maximum contaminant level goal of fluoride that the EPA has set. And we have many studies, and they're showing that it has a lower IQ. Jimenez, in 2017, enrolled 65 mother-baby pairs in an endemic hydrofluorosis area in Mexico, and reported that pregnant women from endemic hydrofluorosis areas had high levels of fluoride in the urine. Maternal exposure to fluoride was negatively associated with cognitive functions in infants. Bashash used similar data. This study had professors from Canada, the United States, Mexico, and a very robust study, best we have, confirming the other more than 50 studies that the average fluoride intake and range of fluoride urine levels in the Mexican mothers was about the same as that in the women in the United States. The higher levels were similar to what is found in areas in the US with fluoridated water, and the lower levels were similar to what is found in the US most unfluoridated parts of the United States. And they found a 5 to 6 point IQ drop. The loss of IQ is very large. The child of a mother who is drinking 1 part per million fluoride would be predicted to have about a 5 to 6 IQ point lower than if the mother had been drinking water close to 0. The average urine fluoride level in this study of 0.9 milligrams per liter implies that a woman was ingesting the same amount of fluoride as a woman drinking about 0.9 milligrams per liter of fluoride in the water. In other words, the urine, if we're drinking fluoride water at 0.9, some of the water is excreted in our breath, some of it is excreted in our sweat, some of it in our feces. And so what we're looking at is, although the urine is a smaller amount of water than what we drink, the concentrations are roughly the same. If they're not getting a lot of fluoride from, say, like toothpastes and other sources. The range of fluoride exposure in this study is likely to be very close to the range of fluoridated areas in the United States. This study was very carefully done by a group of researchers who have produced more than 50 papers on the cognitive health of children in relationship to environmental exposures. So fluoride is not their only area of research. They've done it in other areas. Controlled for a wide range of potential confounders and confirms less sophisticated studies. We took their graph and added a couple things to it, making it simpler to follow. There's a decline in IQ with the maternal urine fluoride increases. So if mom has a fluoride of 1 in her urine, we can expect that it's about 5 IQ points lower than if she had 0. This was from the 4-year-olds on the graph. The older children showed a little bit of a plateauing at lower levels. Now, there's been criticism of this, as there is with every study, but the criticisms, in my opinion, are just red herrings. For one, they said, well, yes, urine fluoride was measured, but they didn't measure the total fluoride from all sources. Well, nobody's done that because there's so many sources of fluoride. Mechanically deboned meat, for instance, they grind up some of the bone in it as they're grinding up for your chicken nuggets, and you get a high fluoride in there. How much fluoride were they swallowing in the toothpaste? I mean, there's estimates of this type of thing, but it's not measured. The way you measure is with urine or serum, and that's the best measurements because you get fluoride from so many sources. So saying that they didn't measure the total exposure, that's not possible realistically. They also said, well, we don't know what there have been no national studies in the United States on what urine fluoride concentration is in the United States on a national level. Okay, we have it from Canada, we have it from Ireland, we have it in studies, but yes, there's not been a national study. So therefore, what they're implying is that, well, it's safe and effective until we do the studies. And why isn't anybody doing the study? Well, that's a good question. Why aren't we looking at what we're mass medicating that the FDA has said it's not effective? So this is a real concern. There is no lower limit of fluoride in the urine for pregnant mothers. In pregnancy, they should not be getting fluoride supplements. They should not be getting fluoride foods. They should be eating organic foods. We need to be very careful of it. And infants, now that's one, there are a couple studies, 3 or 4 studies on the in utero and some animal studies in utero. In fact, the animal studies, one of them showed that there was multi-generational damage to the neurologic system from fluoride. But that's a different story. And so what we need to do is reduce it for infants, and we need to reduce it for children, and we need to reduce it for pregnant moms, and also fertility is affected with fluoride. So that brings it over to the sperm and the egg and the, wow, it just goes on and on. Fluoride is a very strong element. This is what happens when we lower our IQ. There are 6 million people that are mentally retarded. That's the phrase that was used at the time. There's 6 million gifted. When we reduce the IQ 5 points, it ends up with 9.4 million mentally retarded special education children, almost more than a 50% increase. And we have a 2.4 million gifted. Well, it's cut more than half on the gifted. It affects all of them. It's hard to measure IQ. You don't know how intelligent your child should have been if they hadn't had a toxic overdose of fluoride, but it does create a societal problems. We know that there's a lot more crime with children who are on lower IQ. They want to succeed, they want to do as well as everybody else, and they can't get a job that pays well enough, and so they go into crime to try to steal their way to success and to impress their friends. So this is really a problem, and when we start lowering the IQ, we cause serious problems to our country. Fluoridation does not make America great again, that's for sure. Lead levels increase in fluoridated communities, 2 times higher for whites and 6 times higher for blacks. So this is a concern. And where does the lead come from? Well, there's a little bit in the, there's a little bit of arsenic and lead and silicone and all the rest of that, silicates in water fluoridation products. But the acid, even though they buffer it, the acid does, we feel, leach out the lead from the pipes and the brass fittings and all those kinds of things. So that's where we're probably getting most of the lead from. Spittle, the only assuredly safe level of fluoride is 0. He's the editor of the Fluoride Research Journal. Safe levels have not been determined nor standardized. Mounting evidence presents conflicting value to its presence in biological settings and applications. Fluoride is a well-known carcinogen. When swallowed, fluoride goes to all tissues, not just the teeth. Fluoride, a well-established environmental carcinogen. We have evidence from many, many studies, and you can email me if you want to have a whole bunch of studies on fluoride and its carcinogenic effects and the mechanisms of how it causes cancer, etc. Basson reported an association between age-specific fluoride exposure and risk of osteosarcoma, with the highest risk for childhood exposure for young males, a 5-fold cancer increase. That study has not been refuted. Sandhu showed an increase in osteosarcoma also. Burke compared, and you probably had this in dental school, I did, showing that there was an increase in cancer in the fluoridated communities. The problem is that the study was stopped because the non-fluoridated cities started to become fluoridated, and there was a rebuttal on this study saying that no, it was not true. Well, the problem is when Burke went back and looked at the rebuttal, it was found that the math was wrong. So no one has refuted the study. Kim Douglas said, oh, well, the Basson study's not right. Here we have one that uses measured bone level fluoride concentrations. Okay, wow, we've got a better study. National Institute of Health said, yeah, this mixed evidence on the carcinogenic properties of fluoride, so we're okay still because it's mixed. Well, hang on a second. Let's read the study. The Kim Douglas study, remember, Douglas, if you know anything about him, he's the editor of the Colgate Journal, goes to dentists. He is a strong promoter of fluoride. Colgate pays him over $1 million a year, from what I've heard. I haven't seen the receipts. And so he's a strong proponent of fluoride. So what he did, got Kim to look at the data that he'd been collecting, government-funded studies for many years, and he'd never published on it like he'd promised. And he compared 2 cancers. Now, hang on a second. How do they know that the tumors aren't higher in the fluoridated community patients and the osteosarcoma higher? And so when they compared the bone fluoride concentrations of tumors and osteosarcoma, they found that there was no significant difference. They're both high. What you need to do in a study is you need to compare normal bone concentration with the disease. And what they did is they had lots of other problems. I won't get into all those problems. Suzuki compared normal fluoride concentration to about 212 parts per million, and that's for a similar age, actually a little older age than what Douglas and Kim used for their cancer patients. So it is lower in the normal patients, but it's not that much different between the 2 cancers. Hundreds of research articles have reported harm. For instance, in the 1950s, doctors in Europe and South America prescribed 2 to 5 milligrams of fluoride for the treatment of hyperthyroidism. It slows the thyroid down, but we know when the thyroid slows down, we also have problems with obesity. Clinical considerations, and this is my last few minutes that I want to spend here on clinical considerations. These are what I have put together based on my study and what I use for my patients. You have to consider what you want to do for yourself. There's no federal agency and there's no manufacturers that are giving any cautions on this, and they should be. So this is Bill's best understanding at this point. There's some dentists who agree with me. I've run it by several of them, but you need to consider it. Avoid drinking fluoridated water. I know some people will not go to a restaurant where it's fluoridated. Well, I usually eat fluoridated water. I mean non-fluoridated water. I live in a fluoridated community. I take a bath in fluoridated water, but I want to reduce my fluoride intake so I don't drink fluoridated water whenever possible. Do not prescribe fluoride supplements. I no longer prescribe supplements for my patients, of which I did. I had just talked to a mom the other day where she was giving fluoride liquid to her child, and the problem is that the pharmacist wrote out that it would be 1 dropper of the liquid. Well, it should have been 1 drop, not 1 dropper. Anyway, so I see less liquids now than pills, but the pills are not FDA approved. Don't do it. People are getting too much fluoride. Do not swallow fluoride toothpaste. FDA says don't swallow it. I mean, these are just basic logical things, in my opinion. Routine fluoride varnish is contraindicated. When I took over from the dentist that I've been working in my practice, every patient automatically got fluoride varnish every 6 months. That's just the way it was. He was making over $100,000 a year on fluoride varnish. To cut that out really cut down on the income of the practice. There's no question. But why would I give fluoride varnish to a patient who has dental fluorosis? Now, there was a review of this, and I can get it for you more. Dr. Lineback is the one who gave me the information in it. And there are 2 indications where the research shows that there is fair evidence of benefit from fluoride varnish. On all the others, the evidence is incomplete. But the fair evidence is for cancer patients, radiation therapy, and I don't have many of those patients. The other is for rampant caries, and I do see some of those occasionally. However, I work with them with their cleaning, I work with them with their diet, get rid of the cause of these problems, and they don't need to take chemotherapy. Fluoride-free polish paste is routinely indicated, in my opinion. You don't need to use additional fluoride when it's very high concentration against the tissues, which does cause apoptosis on tissues at high doses if it's left there very long, like varnish might do. But I don't want to give them any more that is absorbed through the skin or swallowed. And we know that you just can't rinse and spit all that stuff out. Alternatives to fluoride medications and dental products should be considered along with organic foods, which have less of the fluoride pesticides. Chemically sensitive individuals should avoid bathing, use a fluoride filter. Now, that's one of the problems. The Brita type filters do not take out the fluoride. Clearly filtered is supposed to. They claim they do. I have not double checked their data, but their data seems to be valid. That's one of them that I use. But there are patients, especially the Downs kids, who are chemically sensitive, who can't even take a bath in the fluoride water or a shower in the fluoride water. Even with the filters, they have to reduce the amount of time with it. There are others who break out with rashes. I had a dermatologist, when I talked to a patient, said, don't use fluoride toothpaste. She smiled and she said, I don't. I said, oh, that's a little bit unusual. Yeah, my dermatologist said that I was breaking out with angular cheilitis, the problems of the corners of the mouth, because of the fluoride toothpaste, to not use it. And she said, I quit, and it cleared up. So those are some of the issues that you consider. More additional resources, and don't hesitate to contact me. I will do my best to respond, and I appreciate you spending your time with me. This is just a little nudge, and look at more things. Thank you very much.